Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we are here to help you with your musculoskeletal pain, and you can call and speak directly to Dr. Darrow at 866-870-5752, and you get your free book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, when you phone. What do you think? Do you want to talk to Greg?
I do, Greg. How are you? Dr. Marc Darrow, what's going on with you today?
Oh, Mark, it's been so long.
Oh, wait a second. You're my buddy.
Yes, exactly.
I know you.
I have to say, when you know, we've been friends for quite a bit, and when was it? Was it when we were in Israel? You said, and I'm limping around.
I remember. You didn't make it up Masada, did you?
And you said, I can heal your knee. And I looked at you and went, okay, let's try. Anyway, I came back and, I did the 10 sessions because you said.
Your knee was pretty bad. Did you have surgery on it? I can't remember your case.
I had surgery. It flipped backwards. You know, I was going up to jump and kicking a Frisbee, and I came back down to my left leg, and it collapsed backwards. I don't know what that's called.
That's terrible, yeah.
How
long ago was that? Like 20 years ago you hurt your knee or so?
No, I was 17.
Okay. So you're age 17 when that happened. Because I met you maybe, when did we go to Israel? Maybe 15 years ago? 10 years ago? I can't remember when it was.
About that.
The time escapes me. But I remember you hobbling around complaining, and your knee was really not a good knee. But I knew there was good hope for you. And
no, you know that. Well, the good news is the doctor said I wouldn't be able to walk after 40. But
how old are you now, Greg?
I'm 63.
Okay. What kind of activities do you do, by the way?
I road bike about 3 days a week. I do yoga. I don't run anymore. I was a runner.
Okay.
But even after knee surgery was, I kept on running a little bit, but, it progressively got worse and worse. But,
right.
I think really what, for me, it always felt like there was a sharp knife hitting the back of right in the center of my patella there, just kind of really sharp pain. And after about the fifth or sixth, and especially going downstairs.
Hang on 1 second. That was a long time ago. Were we using dextrose at the time? I think we're injecting with prolotherapy, it was. And let me just comment to the audience about that. So Greg is saying, I don't remember it being 10 injections, but maybe it was. But back in the old days, we did. Okay. So back in the old days, the treatment was very, I'm going to not say ineffective, but weaker. And just using sugar water is fine if you have nothing else, but it's not very effective. We used it for many, many years. It's been around since the early 1900s because that's all we knew about. And then some guys got smart and started using blood, whole blood. They just inject blood. But when you put blood into a knee, the knee blows up. It gets an effusion. It produces a lot of fluid. And then they figured out spinning the blood and getting rid of the red cells and just injecting the platelets. And then the knees would heal a lot quicker without the effusion. So back in the day when we did your knee, Greg, and it was a long time ago, we had to do a lot of sessions to get you better. if we were to do that same type of treatment for that knee today using platelets and stem cells, it might be one treatment or two treatments. Who knows? We don't know.
Oh, wow.
Yeah,
wow.
It's just much more effective. And, I don't know if you were listening to the show before, I was talking about Tony Robbins' new book, Life Force. He has buddies who are working on right now new treatments where you inject a knee and the cartilage grows right back. Ours is a process of slowly growing the tissue, but supposedly there are new treatments that will be coming out that need to be approved that will be considered a drug, and so the FDA is involved in that. It's not involved in what I do, but it is involved when you create something that's considered a drug.
Yeah.
And so that may take years. To come out.
I might need some of that.
Well, I don't think you will. I mean, you're doing great. And
I'm fine now. I'm nothing hurts in my knee.
Well, that's amazing, man. I'm so glad. It's good to touch base with you again.
You had said it might last for a bit, but it's lasted all this time. So, and
it's been
maybe with what I was doing with all the strengthening and everything like that helped as well. But
well, listen, you and I need to meet for dinner. It's been a long time. I'm going to give you a call after the show.
All right, let's get some lobster.
All right. All right, Greg, God bless you so much. Okay, I'm there. Thank you so much for calling in. And the number to the show right now is 866-870-5752. That's 866-870-5752. God, what a flash from the past.
That's a cool story.
It really is a cool story. And Greg and I met on this trip to Israel with about 100 people. It's like one of these trips that...
I remember when you took that trip.
How long ago was it? I don't remember when it was.
I think it was about 15, 16 years ago.
I think it was about, yeah.
Because you were treating me again, because I had re-injured myself with a trainer.
Yeah.
So I remember you were going to Israel, and I remember all that. Also,
it was so weird because Greg is this good-looking dude and very happy guy, and I see him limping around, and he couldn't make the climb up to Masada with me. That's up the mountain.
Yeah.
And he had to take the tram. And I said, that's really a shame, a young guy like you, because at the time he was probably, I don't know, like 40 or something like that. And I said, I can help you. I can probably help you heal up. And then he came in, and I'm surprised. He's saying he's doing road biking. I forget what he said, 3-4 times a week.
And yoga.
And he said he isn't running. I don't know if that's because he doesn't want to or he's afraid to or whatever it is, but I think he could probably be running again if he wants to be. So that's the hope anyway, Greg. I don't know if you're still listening, but I am going to call you after the show and we'll get together for dinner and talk about old times. What a flash.
That was great. That was a great call.
Yeah.
So when you phone 866-870-5752 today, not only can you speak directly with Dr. Darrow about your pain, but you get his latest book for free. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has 264 scientific studies, and the foreword is written by Suzanne Summers. And you're in her new book, A New Way to Age. It looks like you almost practically got a whole chapter.
Not practically. Page 302
to 316.
Interview with Dr. Marc Darrow.
Mm-hmm.
Yeah. It's a great book, though. It's about all types of natural healing. And
okay. You want to talk to Marilyn?
Oh, yeah, because she had a vampire facelift, but I'm not dealing on this show, Marilyn, with vampire facelifts. But I'll talk to you because you called. So Marilyn asked me about the vampire facelift. Go ahead.
No. Well, really, I didn't hear exactly what it was when I heard you talk.
Oh, okay.
Briefly.
Well, I'll tell you briefly what it is. Let me wait. Let me just tell you briefly what it is. It's a very simple procedure that's done in my office where the same cells that I put in the musculoskeletal system, the ligaments, tendons, joints, all of that, they're actually put into the face. and they're put into the face to regrow the tissue there, just like I'm doing in other parts of the body. As everybody knows, when we get older, we shrink. The discs in our back, which are the cushions between the vertebrae, start to dry up, and we actually shrink. I used to be 6'1". I'm probably about 5'11" now. And I've had a lot of back injuries, neck injuries, a lot of disc injuries, so I'm a little bit shorter. I'm still pretty spicy there, though. I still get out and do sports all the time. And I'm not really having any back pain. I have had it before, and I've injected it and gotten rid of it. But the vampire facelift is analogous to what I do, but it's for the face. It makes people look great, and we have as many men as women who do it. I've never done it on myself, but our patients do love it. So, Marilyn, what is your question about the vampire facelift?
Okay, well, unfortunately, the last time I saw a dentist that wanted to pull another wisdom tooth,
right?
pulled it, and it's been about three years.
Okay.
And now my cheek on that side is just starting to sink in.
Yeah, okay.
And so, and I'm afraid of Botox.
Okay.
And so when I heard you say something about this, I wondered if that would work.
I don't have the answer. I'm not the person who does that in the office. You'd have to talk to my wife, Michelle, and she could look at it and tell you. I'm not a cosmetic kind of guy. I grew up.
This isn't really cosmetics. It's that the cheek is, denting in.
Well, that's cosmetics. I mean, you're functional. You can eat.
Yeah. Okay.
Yeah. So it's cosmetics. She could probably help you. I don't know if it's the vampire facelift or fillers or whatever that is. And if it were really bad enough that it was functional, there are doctors who do stem cells to regrow bones, and it sounds like it's bone resorption that took place there. It's outside.
My cheek.
Yeah, it's outside of my league. I don't know if that's soft tissue or bone or whatever it is. It's just not what I do for a living. I do very specialized work on the musculoskeletal system, not on...
Well, don't you agree that Botox is kind of dangerous?
I'll give you my hit on it, my own personal thing. I don't like it personally because it's inactivating muscle. And I'm talking about just for the musculoskeletal system. I know people get help with headaches for it, and people like the way their face looks when there's no lines in it. I'm not commenting on that. I'm talking about people that get it for pain when they could fix the area instead of de-innervating the muscle. So I think it's a lesser treatment for musculoskeletal things. But people do it, and some people like it. And for cosmetics, it can be very good. And for headaches, it can be very good.
Okay, well, then I guess I should just call your office and see if I can get an appointment with your wife.
Yeah. You'll like her. She's fun.
All right, well, thank you very much.
By the way, Marilyn, you can go to the website, which is www.lastemcells.com, and you look under the menu bars, you'll find a video of her doing the vampire facelift. You can actually watch it in action and see if that's something you think may be applicable to what you want done. Okay?
All right.
All right. God bless you. Thank you so much for calling. We're going to go to Kimberly. Kimberly, Dr. Marc Darrow, your husband will go to a knee surgery soon. Tell us why. What's going on with your husband?
Well, he's been in pain for about a year and a half on his left knee.
Okay.
And he's now scheduled. He's gone through 4 or 5 cortisone shots there.
Oh, that is the worst thing anybody could do. The worst.
Well, and that's basically what they've been doing. So it lasts for a couple weeks, but then he says almost a 10 pain. And it's been going on for a year and probably almost a year now, maybe a little over a year.
Okay.
So
I want you to do me a favor. Kimberly, I want you to do me a favor. I want you to Google cortisone and cartilage, and you're going to be shocked.
Okay.
You'll be shocked at what happened to your husband's knee. It's just a bad thing to do. It's traditional medicine. It is what doctors do. I'm not putting them down. They're just following their Bible. I have a different Bible. My Bible is to help people heal, not to help them disintegrate their joints and their cartilage, and that's what cortisone does.
You can help somebody with, they say it's arthritis, and they're saying he's almost bone on bone, and he's a big bone guy, and he's going to go in for surgery in the next 6 months, and I'm very worried about it.
Okay. Well, look, I don't know, have you listened to me speak today or on the show before?
No, never.
Okay. Well, my points of view generally are don't use cortisone. Try not to use medicine at all if you can help it. There's some medicines you have to take. If you have high blood pressure and you can't lose weight and you can't exercise to lower your blood pressure, you may need high blood pressure medicine. But most medicines I don't like, and there's natural ways to do things. And I don't like cortisone injections into the body. And I definitely don't like surgeries unless they are emergency or mandatory. And knee surgeries generally are not. And I think your husband has been sold a bill of goods. I'm not talking negatively about his doctors. They're following their protocols and they're doing the right thing for them. But it's not something I would do. And there's basically no such thing as bone on bone with joints. I rarely ever see it. It does exist, but it's not real. It means the cartilage is worn down, but it can also be healed in most cases, not all.
I'm sorry, you're cutting out on me.
Okay. The best thing for you to do if you want to talk more is pull off the side of the road, get off your Bluetooth so we can hear you.
Okay. Let me, I'm going to schedule an appointment for myself.
Okay.
But, I think I need to have a better conversation if I can get him in there before he does the surgery.
Sure.
Is it something that maybe you could help with, or would that be something more medically that we have to handle differently?
I have no idea. I'd have to examine the joint to find out what's going on.
Okay.
The number to the office is 800-300-9300, 800-300-9300. And we're going to send you out. We're going to send you out a free copy of my book for calling in. Stem cell and platelet therapy, regenerate, don't operate. It's got 256 studies in it that show why not to do these surgeries and why regenerative medicine is really a better alternative in most cases. Not all. There are occasional times when I send people to surgery. I can't remember when. It's been so long, but yeah, if your knee is smashed, broken, or something like that, you better get to a surgeon, get to the ER and get to a surgery. But most of these surgeries, in my opinion, I'm just one guy, don't kill me, I don't think they should be done.
Yeah. Yeah, I'm kind of the opinion of the same, and I've been kind of worried and watching, and it could cause all sorts of problems down the road. So, okay, well, that you give me good insight, and I'm going to look up that link on cortisone and what it does.
Yeah.
I've done one shot of my knee, and I went back one other time, but it never really solved the issue.
Well, actually what it did is it dissolved a little bit of tissue away. It's not something I do.
Right. Right.
There are cases where cortisone is magic, but not in weight-bearing joints.
Exactly.
That's destructive.
So I do want to make an appointment, and I'll call the office for myself, and I'm going to try and get my husband to go with me.
You know what you need to do is get yourself a rope. Get a rope, put the rope around his neck and drag him in. That happens every day.
I can do that.
There's usually one half of the married couple is sitting there grumbling because they got dragged into the office. But I mean, it's silly to do something invasive in medicine when there's an opportunity to do something conservatively that's easy.
Right. Hopefully he's listening to this.
I hope so.
Me too. All right. Well, thank you so much. I appreciate it.
All right.
Your
Well,
help.
God bless you and God bless your husband. And I hope we get to see you and help him, actually help save him from an unnecessary surgery. Maybe he needs the surgery. Okay. I don't know. I wouldn't be able to tell you until I actually examine the body. But I rarely find people that need surgery. I have people that come in every day who say they were told they need surgery every day. And then I laugh after I examine whatever part of the body is, and the patient goes, "Why are you laughing?" And I go, "Because you don't need surgery. That's ridiculous."
Yeah. Yeah. It's pretty invasive, to do a knee. All right. Thank you so much.
You know, the bottom line is this. I tell people all the time. I used to love doing orthopedic surgery. It's a real guy thing. There are a few women that do it, but it's a guy thing. You know, the rock music is blasting and you feel like you're God in there. And, you cut it open, suture it up, fix it, whatever it is, and suture it back, and you feel like you're God. The person walks out at some point, hopefully. The problem is I saw way too many failures. And the reason I got out of it was because my boss did my shoulder. And I'm not saying he screwed it up, because he probably did a perfect surgery. It screwed up. And I had about a 4-year episode of misery before I found regenerative medicine, injected my own shoulder one night. And it's a funny story. I tell it almost on every show. I came home, and I was in residency at UCLA doing my residency. And I came home one night. My wife was laying in bed watching TV, and I had a syringe ready to inject myself. And I figured I'm going to give her a little shocker. And I climbed into bed, and I started to inject my shoulder, and she started yelling at me. She goes, like, what the X are you doing? And I said, well, I tried this on my wrist and it worked. I'm trying on my shoulder. And I woke up the next morning 100% full range of motion, which was lacking before, with no pain, which was terrible before. And at that point, I was like, this is going to be what I do for a living for the rest of my life. And I've been doing it now almost 25 years with amazing, great success. It's a form of medicine using your platelets and stem cells that is so easy, so simple. There's very, very few side effects. If any, you get a little bit stiff afterwards. And I love it. I just absolutely love doing it. I do it on my own body when I need to. And, if people listen to their doctors and get this, they usually get better. But, a lot of people don't want to listen. And then they go, it didn't work. All right.
So how about that phone number?
Yeah, let's give it out. My number here to talk to me live is 866-870-5752. Give me a buzz, 866-870-5752. If you're shy or you can't get to me right now, you can call the office at 800-300-9300. That's 800-300-9300. And if you give me a call now, you get a copy of my free book. It won't be free unless you call now. And that is Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's $25 value. The introduction is by Suzanne Summers, the wonderful person who's been through an awful lot of medical issues, of which most she's been able to handle with what we'll call alternative medicine. It's not alternative. It's the mainstay of medicine throughout history. I think high-tech medicine is alternative medicine, and unfortunately, the high-tech medicine can help people, but it can also really hurt people. And one of the things that happened, I've mentioned before, I had a sister, Lila, who died from one shot of chemotherapy. She had thyroid cancer, had her thyroid removed, was healthy, and her nice doctor said, you know what, Lila, let's put you in the hospital for one shot of chemo just to be sure. And she died within a day. She had an infection from her immune system diving, and she got septic, and boom, bye-bye, Lila. So I don't like medicine. Anyway, we're going to go to Alex. Alex, Dr. Marc Darrow. God, today is knee day. I just want to say, Alex, before I get to you, I do the whole body. And Alex, go to the website because we got to leave the show. It's www.lastemcells.com. You can email me from every page, and those of you that missed me, call me at the office, 800-300-9300. Thank you, Nita Valens, Suzette, Alex, and the whole staff. God bless you all, and have a wonderful day. We love you.
Thank you. And remember to listen to our pal Warren Eckstein on The Pet Show from 11 to 1 every Saturday, and we'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.